We want to bring in NBC News medical correspondent Dr. John Torres. Dr. Torres, good morning.
Good morning, Peter.
So, Doctor, we saw that grim death toll yesterday, 2,000 Americans losing their lives. But from public health experts and others, we are hearing optimism now. New York appears to be either at a peak or at a plateau. But for most of the rest of the country right now, where are we in all of this?
And Peter, what you're seeing is the coasts are actually doing a lot better than they thought they'd be doing at this point. That you're hearing about the increase in deaths, but the deaths tend to lag behind the actual cases. So the cases are either staying steady or going down, and that's including New York, California, Washington, those areas that got hit immediately. The concern now is what's going to happen with the rest of the country. We're hearing about hot spots possibly cropping up in other areas, and this is something that experts thought would probably happen, and to start going from areas where there's a lot of travel, a lot of airport travel and travelers go to, and they can spread it, and then it starts spreading to other areas. The lucky part is the other areas of the country, or the good part is the other parts of the country actually started shutting things down very early, so hopefully it doesn't affect them quite as much. And I think overall, the nation, you're seeing optimism and saying it looks like we're actually tackling this, we're getting this under control, and we're starting to see that light at the end of the tunnel, Peter.
Dr. Torres, yesterday the president announced that more than 2 million Americans now have been tested, but it's out of a country of 330 million Americans. He said that the virus will soon be in retreat, but without widespread testing, how would we know?
And that's going to be the difficult part. And like you said, or like he said in the task force briefing, you want to make sure that people go back to work, but they stay healthy at the same time. You want both to happen. And the realism is once people start going out and getting in crowds and getting close to each other, those numbers are going to pop up again. But we want to make sure that we have a good understanding of where those numbers are starting to increase so we can start shutting things down. And that means testing. Two different types of testing. One, do you have the virus right now? We have that test now. It's not as robust as we'd like, but it's getting there. And number two, the antibody test. Who has immunities to it because they already had it and they've recovered from it? On top of that, they're going to have to look at cases in the hospitals, see what's starting to increase in hospitals, and keep a good understanding of that, having hospitals report to the CDC saying, we see more cases, and then start putting in task force, essentially, the CDC sending in essentially the equivalent of coronavirus SWAT teams to go ahead and keep it under control every time these hot spots crop up and keep it down.
So, Dr. Torres, can we drill down on that antibody test right now? That would be a significant piece of progress in this effort across the country right now. As you noted, it would tell people if they already had the virus. Some wouldn't realize the case because they never showed symptoms. Is that a game changer? Would that allow us to accelerate the process of getting back to work?
It is a game changer. The ultimate game changer is going to be that vaccine. We're talking 12 to 18 months before we get that. So in the interim, the big one is going to be getting that antibody test so we know who's been infected. Part of the issue is going to be that once you get it, how are you going to identify people that actually have antibodies built up to it? And we don't know that much about this virus yet because it's new. And so just because you have immunity, do you have enough immunity? These are questions experts are going to have to try and figure out over the next few weeks. Those tests are going to become available. The issue is, are those tests going to become readily available? It looks like it's a faster test, 5 to 15 minutes, so it's not going to be necessarily the cumbersome process that the other test was when it first came out, but it's going to be something that's going to take a little bit of time to deploy.
Dr. Torres, stay safe and healthy, my friend. Thank you very much.